Hi, Michael Kowalski. Welcome. We're so happy you're at the conference this year.
Thank you very much, Ellen. I'm delighted to be at this conference and to be presenting again at FSOMA.
Yeah, well, I know you're an expert from your classes before in 5-element acupuncture. What can you share about your education and background with that?
I started training with Professor J.R. Worsley in acupuncture in 1981 and over at his college in England. And when I graduated in 84, I was honored to be offered a faculty appointment and worked very closely with him and the senior faculty at the college for many years. I actually stayed from 81 until 88.
Oh, wow.
England, and did a lot of personal one-on-one training with him, as well as some group training with the other senior faculty who were in the teaching clinic there. And I practiced in his clinic at the college. So I got a great head start in 5-element education and practice in those early days. And then I moved back to the States, back to Florida, in Jacksonville, Florida in 1988. And I've been in practice here ever since.
That's great. So what got you interested in acupuncture to begin with?
It was interesting. My stepfather was an acupuncturist. And when I met him, he was already practicing acupuncture instead of plastic surgery. He had originally trained as an MD and became head of plastic surgery in a large hospital system in St. Louis, Missouri, and had a severe road traffic accident, crushed every bone in his body, including a skull fracture. And Professor Worsley was his acupuncturist and brought him back to full health.
Wow.
And it was quite a remarkable recovery that he made. And I met him after his recovery, and he began treating the whole family, including me. At first, I was afraid of needles and I didn't want any acupuncture treatment, but I had a basketball injury and I was wanting to rehabilitate and play basketball again. And so he helped me with my knee issue. And then that led to treatment of 5-element acupuncture, which treats the whole person, body, mind, and spirit, and treats at the root cause. And I became very fascinated. I was actually a student at Yale University at the time. And I thought I was going to be a lawyer, but I switched careers midstream and went for acupuncture school right out of college.
Oh, wow. That's very lucky to be in it for so long and so young. So, all right. So what will you be teaching us at the conference this year?
I'm going to be teaching the 5E approach to headaches. So we know from the meridian and channel systems of the head that we have gallbladder meridian, we have stomach meridian, we have bladder meridian, and so on, all the different channels that run through the head. And we understand the connections with the liver opening into the eyes, and the different meridian pathways certainly play a role in causing headaches. But in 5-element acupuncture, we look to beyond just those kind of signs. We look to the root cause. So why, for example, with a bladder type of headache that is occipital and coming around, why is the bladder meridian out of balance? Or with a gallbladder headache, why is there a headache on one side of the gallbladder meridian? So the root cause is going to give us an insight into the whole person. And in 5E, we treat the person who has the headaches or whatever symptoms there are, not the symptoms themselves. And so we can do work on the meridian channels for sure to open them up, get better energy flow through the head. But if we don't treat the root cause of the problem can continue to reoccur.
Yep, keeps growing branches, doesn't it? Yeah.
Yes.
Okay. So why do you feel like this topic is important to share?
Well, I think it's very important for our FSOMA members to understand about 5-element acupuncture, that there is this option for them to practice in this way. It's a wonderful system of medicine. It's very elegant, it's very deep, and it really brings a lot of richness to our practice of Oriental medicine, to be able to get to the root cause of patients' problems, to be able to understand patients at a deeper level, and to relate to them in a deeper way. It's not just a conversation of where does your head hurt today, but looking at the factors that are behind these headaches. Many times I have patients with migraine headaches, and it could be from something simple like dietary allergies or something like that, which certainly can play a role. But even with those kind of cases that are very tied to a physical situation, like what you ate or what you drank, it's still very important to look at what kind of stress the person is dealing with in their life, what their emotional makeup is, and if there is some stress component to their headaches, which often there is, I find.
Great, thank you. So, so we've got you on the schedule for the conference. How can people contact you if you have questions about your class?
People can go to my website, www.treatrootcause.com. It's my practice website. That's treat like you're treating a patient at the root cause, treatrootcause.com. Also, they can go to my website for my teaching. I teach postgraduate courses for the state of Florida, continuing education courses in 5E. And the website there is www.5elementinstitute.com. And you can contact me directly through those websites. I'll also give my FSOMA members a direct email to me. It's Dr. Michael, DRMICHAEL, at treatrootcause.com.
Okay. All right. Well, thank you, Michael, for spending some time with us and sharing about the conference and your class. We look forward to having it. I've learned so much every class I've taken with you at the conference. So thank you.
I appreciate that very much. It's
right.
Great. And I'm really looking forward to being able to present at this year's conference.
All right. Thank you.